Again, want to welcome everybody. We're excited to be sharing with you how Be Nice, the action plan, fits perfectly into school safety, and how utilizing the action plan, notice, invite, challenge, empower, can actually definitely help with potential that there could be someone at risk, again, to harm themselves or harm others. And in the work that we do surrounding mental health, these are the type of things that we always need to be aware of, because when someone is in a mental health crisis, they are not only possibly thinking about taking their own life, but they could be thinking about taking the lives of others. So in light of the tragedy, we knew that we needed to come back and remind people of how important the action plan is. And then in addition, like we're hearing on the news right now, all over the place, is we have to get students involved in planning on how to approach school safety. And this is where Be Nice is just so important. So I'm Christy Buck. I'm the executive director and founder of Be Nice, and I'm really happy to be here today. Thank you for joining us. We will get you off the call by 12:40, but no, by 12:15. We promised it would be 45 minutes. So in the chat, if you could put in what district you are from. Sometimes you can't tell by someone's email where they are from. So again, reiteration of what is Be Nice. And we love Be Nice. It is an action plan to notice, invite, challenge, and empower. And ultimately, this is creating a knowledge base surrounding mental health, mental illness. Ultimately, what we want to do is to increase the confidence to take action. So in situations when people are in that downstream spot where they're thinking about harming themselves or harming others, we all need to be armed with the confidence then to take action to help someone get help. So where do we fit in our line of work? Be Nice is an education program. Can't do anything without that good pink circle, and that is where school social workers, counselors, our community mental health system, what facilities are in our area that can help out when someone is in a crisis. For employees and employers, do we have an employee assistance program? And that today I would like to challenge you all. Most of you all are educators. Does your district offer your staff employee assistance programs? Where's their in and outpatient therapy? And then who are the private practice folks in our community that can help out with treatment? In addition, that blue box are where are the support networks? And now we know the importance of advertising and making people aware of what are these support networks available for us, for our students. Are we advertising enough the 800-273 talk line? We know that every student has an ID, and on the ID card, it was mandated by our state that students had to wear that phone number. It's going to switch up to 988 by next summer. We will all be on board. And then a great organization, a great tip line is okay to say. In some districts, they also utilize Silent Observer. Are we all on top of it to make sure that these are the phone numbers available for conversations, for support? Next. So I'm asking you all, what is a proactive approach to school safety? And I am on the Granville School Board, so I got a double workload here. So not only do I work for an organization who believes in school safety, I'm part of a school district that also believes in it. But oftentimes when we are challenged with school safety, we'll get a lot of reactions from different people making suggestions to us. This is the approach we need to take. So some of these are arm our teachers, ban violent media, stop violent music, video, stop bullying, more school police, buy metal detectors, teach parenting skills, take away phones, social media, faith-based solutions, that's the way around this, teach empathy. Where are the dads in this? So you hear a whole gamut, and these are that reactive approaching, right? So in our situation, we know we want to push out proactive approach, and that is providing psychologically safe environments where all students, faculty, and teachers, admin, we're all moving in the same direction to provide a safe environment that's psychologically safe. So coming out of the Office of the Attorney General, here we go. This is right after the Sandy Hook school shooting. If communities, schools, government, and other key players pull together to address the roots of violence, we can make America safer for our children. Communities around the country are proving that prevention and intervention strategies that help keep young people out of trouble do work. So it's critical that we can identify young people who need our help and then get them the help they need. And that's what's exactly happening under the N of the Be Nice Action Plan, to notice. So noticing and being aware of fact, right? We all know these statistics. We are the first line of a psychologically safe environment. Right now, those who are at the meeting today, be a believer. We know that 1 in 4 families are affected. 1 in 5 Americans struggle. We're more likely to come into contact with someone experiencing a mental health problem than someone who needs CPR. Depression is a leading cause of disability. More than 90% of people who die by suicide have depression. Next. Many children will go untreated. We know that suicide is the second leading cause of death amongst 10 to 14-year-olds. Oftentimes, violent behaviors come along with an end result of someone taking their own life, which is usually the end result in a school shooting. The shooter will end up dying by suicide. Half of all mental health disorders begin by the age of 14. We know that mental illnesses left untreated, left undiagnosed, can have a negative effect on the brain development. So popping into the action plan and how it can make a difference with school safety. Notice, invite, challenge, empower. Going back to the basics of notice, what is right, what is good, making sure that we're pummeling out kindness, recognizing good behaviors, recognizing when people are putting effort into themselves, into making a difference in our school environment. This is a big challenge oftentimes right now in the political climate that we are in also, but making sure that we know that our leadership groups in our schools right now that are pushing Be Nice, they have a big job. How can we do this, right? Again, going back to the portal and making sure that we continue and forge on to offer out activities, right? That last step is the biggest one when we are noticing what is different. And that is where our groups need to be led in that direction to make sure that we're pushing out those mental health awareness tools, what we need to recognize in people's change in their behavior. One big thing is noticing how can we do things better. We have a specific talking points handout, which can be found on the Be Nice portal. And that is something we want to encourage you all to take back to your leadership groups at your schools, is recognizing how our school is safe because. And that is recognizing that within our school, as students, as faculty and staff, our school is safe. Why is it safe? If we have an officer, if we have security that is within our school, that is offering our school is safe because. Is our school safe because when you first walk into the building, you are greeted and understood by receptionists and secretaries that are waiting to say hi to people? Is our school safe because we have social workers who are on duty to help recognize, they're available to be able to talk to? Those are helping to make our schools safe. Our school staff works with our local police, our fire departments. We know that in an area where we have a dedicated police department, that they're knowledgeable about our school district, that's increasing safety. We want to make sure that we know this. How can we improve and learn? We know that programs that are offered, Be Nice at the elementary, middle, and high, are consistently reinforcing the message of noticing, inviting, challenging, and empowering. So in a district where we are embedded in all 3 levels, it means that elementary school students are also learning the plan at a young age. And that is learning those simplistic things of noticing the good, the right in individuals. So then I can notice the difference when somebody might not be feeling good mentally. We have Be Nice Extension, and these lessons are on the portal. I want to remind everybody, we're going to be doing some extensive trainings on Be Nice Extension to be able to offer this to some of our liaisons to take this into the classroom. We are instructors in mental health first aid and have been doing this for the past 9 years. This is a comprehensive program. It has been interesting. In the past week, we've had reach outs from 4 different school districts asking about engaging their staff in mental health first aid. Next. So noticing in school shootings, what are some of the risk factors that we know? And this is what everybody should understand. According to the Secret Service, a school shooter is more likely to be Caucasian, male, a student that possibly is withdrawn, a student that has been isolated or rejected by peers. This is why Be Nice is so important at that macro piece. And that is working on engaging all students, helping to people feel less rejected, less isolated. Living in a rural community, biggie, having easy access to weapons. And this is why it is important as districts, we do talk about gun safety. We are not taking on the NRA at all, but what we're talking about is making sure that parents have information about gun safety, and that is making these weapons unavailable to their children. Understanding that locking weapons is gun safety. Bullied repeatedly from a young age, and this is why Be Nice at that micro level and macro level at an elementary school age has that greater understanding that while I'm in elementary school, I want to make sure that I am treating everybody with respect and dignity. And this is the challenge to elementary schools, is taking how we treat individuals very seriously. So by the time we get into that middle school, high school, that we've already helped students who may be picked on, harassed because of the way they look, because of the way they act, because of the way they think, that we've taken this, gotten rid of it at elementary school, and now at that middle and high school, they feel a part of the school. They feel like they can engage themselves in activities, like there is a place for them to participate. There is a group of friends for them. Yes, we know that another risk factor is coming from I'll put troubled home, and that would be a student that experiences ACEs, adverse childhood experiences within their family living situation. So if we look at the school shooting that did happen in Oxford most recently, they did experience several risk factors on our list that has been provided to us by the Secret Service. Risk factors and warning signs, they're easy influenced by peers. So that could be under peer pressure. They're being encouraged with school violence, using fists instead of their minds. They're victimized or poorly treated by their peers. We don't know the whole history on the school shooter. Things probably will end up coming to light, but we know this from other school shootings. Alcohol or drug use, dwells on experiences of being rejected, injustices. They react to disappointments, criticisms, teasing with extreme anger, blame, desire for revenge. Preoccupation or interest in destructive or violent behavior. For this young man, he was showing this most definitely through his drawings, through his writings, through his posts. We're going to hear it over and over and over again, these warning signs. But this is what I want to have you leave today, is understanding that all of these things right now fit in the action plan, what to notice. Inviting ourselves to have conversations. Have we reviewed our health and safety crisis protocols? I know for a fact that most districts, immediately after this crisis happened in another district, and on top of it all in the state of Michigan, people did huddle together and make sure that what are our protocols? We need to revisit this. Have we invited all staff to understand the action plan of Be Nice? We have had in 2 and 3 districts, we were actually the startup in some districts for their welcome back professional development on how the action plan can actually fit into school safety. Are there any barriers to inviting conversations regarding school safety? Do students feel safe talking to staff about things that they notice online or at school? And that is where the action plan is so important. And we know that we use it for mental health, right? But if we look at school safety as overlapping into this mental health arena, right? Because one more time, psychologically safe environments help in both harm to someone and harm to others. So looking at this whole big package, because right now, mental health is at the forefront of the conversation. We need to make sure that we know it's a big package when someone wants to harm themselves or harm someone else. Inviting ourselves to connect, take risks, reach out, invite ourselves to say something, start a conversation again at that onset, at the beginning for this specific situation in Oxford. This young man, I know that everybody in our office went back and kind of wanted to discover what was going on with this young man now. But in addition, what was this young man like before this incident? So there were YouTube videos of him dancing, having fun, smiling, his dad making goofy videos, fun, typical middle-aged young man, right? Now, what happened between the ages of 12 and 15 years old, that's 3 years of a remarkable change in someone's behavior. So at what point were we able to have jumped in and said, okay, this kid is not the same? And this would have been at the onset. When was he thinking, acting, and looking, feeling differently? What was that change in his behavior where it came from this kid having fun, making these videos to suddenly, and what can be happening are some of these risk factors that we talked about in between, where people treating him differently, or the things going on at home that would have been bringing about a change in his behavior. Was there the onset of a mental health disorder? Were there changes that brought about psychotic thinking? Because that would be very concerning to anybody in the mental health profession. So these are big changes that were happening between 12 and 15. You didn't go from 12 years old to all of a suddenly I have a gun and I want to take the lives of other people. Again, at the beginning, inviting ourselves to have those conversations. What's going on with these drawings? A while ago, where did these drawings change? Where did that thought process come about? And we know that our schools are definitely, we've worked hard on bringing about more social workers, counselors in our buildings, more mental health workers. A lot of funding during COVID brought about those necessary changes. Let's make sure that we bring people on with the action plan of Notice, Invite, Challenge, Empower. And knowing that as teachers, as educators, as social workers, clinicians, as students, that I'm going to bring about the responsibility to invite myself to have a conversation. Challenging stigma, as always. Huge piece of stigma happened with this incident in Oxford, and starting with the parents being challenged about counseling, and specifically on that day, and not wanting to take their son out of school. That is stigma. That is stigma, that there is nothing wrong with my son, daughter that would warrant any type of psychiatric assistance. And that starts at the beginning of Be Nice, when you are even integrating a program that is going to talk about psychological safety, that's going to talk about mental health. Right now, that is the first step in the door where we're challenging stigma, a greater understanding that mental health disorders can happen to anyone, that we are all at risk. And those statistics that we showed at the beginning are serious. That's challenging stigma. That's making sure as students, we are challenging this. This is making sure that as faculty, we're constantly challenge this and making it okay to talk about this. Challenging ourselves to ask more questions. How long have you been feeling this way? Those are the basics of Be Nice Challenge, is where I'm starting that conversation off. And then challenging the individual to seek help. We're going to take these risk factors seriously. We're going to talk to our students about the seriousness of suicide prevention. According to the FBI, students almost always communicate their intentions to commit a school shooting. We know that 70% of kids who have not spontaneously, they reported suicidal ideation, they actually communicated these intentions. Those intentions come through many times social media, through writings, through drawings, paying attention. Again, the warning signs were right there. But we're not saying that you here today aren't doing anything in your schools. We're believers, but right now we're going to be hypervigilant, and we're going to know that we need to challenge ourselves to take these risk factors very seriously. Challenging ourselves to ask the question. These are people that have definitely been trained, and we love some of the courses that we offer beyond just today's webinar. And that is specifically, how do you ask the question? And so these are important questions to be able to ask. We do teach mental health first aid, and that program actually is an 8-hour course where we lead up to the point where we're going to ask the question. And that's 1 hour of the training. And we do offer other specific trainings to teach people how to ask the question. Now, in your buildings, I'm pretty sure that your social workers and counselors are ready to ask the question, but in our schools, who is ready to ask this specific question? Again, challenging conversations. Do we have space for our staff to be able to go through professional development, to be able to learn how to know more about warning signs? Do our students know where they can go to get help? This is definitely part of Be Nice, the action plan, NICE, is to make sure that that's what our student leadership group is pushing out to other students. We've got to be able to put up posters about okay to say, about any helpline that is available to our students to call 24/7. With okay to say, we know that when the admin changed, when our administration changed with Governor Whitmer, a lot of funding was taken away from okay to say, but okay to say is still in existence. It's awesome. And that is that they get these tips, and then out goes information to sheriff's departments, to police departments on a tip that they received. It's still there, and we're so fortunate. In other districts, they might specifically have their own tip lines. Love it. Make sure that students know that these tip lines are available. The hotline posters, those are available for free, and that can fit with your Be Nice leadership groups, fit in under challenge. Put up a poster, challenge yourself to use these tip lines. Again, encouraging students to continue to report what they've noticed. Are there any barriers when it comes to reporting concerning behavior? Have our student leadership groups work on these. Do they know where to get information? Do they know? Do all of our students know this? Let's push it out. And oftentimes, students listen to students. Understanding the relationship between harm to someone in our schools and the relationship to mental health. Someone isn't crazy, nuts and psycho because they go and do something so horrific. It ultimately is because that person probably most likely went untreated for a very long time for their brain to feel thoughts such as what that young man felt. I'm not taking away and making excuses. What I'm saying is that's the bad rap that mental health, mental illnesses get, that's what a mental illness looks like. And that's not what it looks like. Because more than likely we have a lot of kids struggling out there right now. And when it gets to the point where someone wants to take the lives of others, wow, that person must have been very, very, very sick. And I can't imagine someone struggling that long with those type of thoughts. Next. Again, challenging the stigma. We can't repeat it enough. A long time ago, why would the student have been hesitant? Our movies that we have made that are available to y'all to use, in all of them, there's stigma very evident. And a lot of the stigma starts at home, where there's nothing wrong with my son. And this is where we need to recognize that we can have these really good conversations with students on their own to say that there is help. Where to find help? This specific slide right here is in Kent County. Do you have something like this available to you in your counties? So the replaceable things in this would be, where is there hospitals in your area where people can access assessments? Where can somebody connect with 211? That's United Way here. And that's where people can get resources to take care of some help and necessary needs that a family might have that is causing them distress. Network 180 is Kent County's community mental health system. Where is your community mental health system? So Empower, best part of the program, and we love it, is having knowledge about mental health, empowering ourselves with our words. How do we talk about mental health? How are we even correcting people in regards to this school tragedy that happened, to basically replace language that people are saying, what a psychotic kid, what a sicko, what a crazy kid, what a nut, what horrible parenting. Wow. You know what? With knowledge breeds confidence to take action. So can we be knowledgeable that this individual must have been really sick? His parents probably most likely weren't educated surrounding mental health and mental health treatment. His parents, maybe they were stigmatizing. Maybe they didn't understand that there is help and treatment for everybody. So nobody ever wants to cause harm to someone else. Some of those drawings that the shooter, the things that have come out that were reported from the teacher in the classroom, that was a cry for help. There were some really disturbing messages that happened the morning of. And how long had that individual been feeling that way? A while, because the posts on social media were there. So can we look at it? This is an untreated illness, just like any illness. And right now we're talking about any illness, a physical illness, how long something goes untreated can lead to someone taking their life, and in this situation, taking the lives of others. So again, prevention strategies, school dynamics, and culture are important. So what we want to work on through Be Nice, through your leadership group, through your leadership, promote the attachment to schools, connect to peers, involvement in activities, relationships with teachers and other adults. Target how students are being treated. Again, with the Be Nice action plan, it can be that simple, that how we treat each other's has an effect on someone's mental health, how they think, act, and feel. Pummel that out, that macroness of Be Nice, and the action plan, how it leads to other things also, that micro of getting help for someone at that first stage of notice. Listen, promote a trusting environment where students feel safe to speak up. How that they're able to go report incidents that you're concerned about to a teacher, to a school counselor, to an administrator. First line where they know that that person will be able to get help. Value all students, monitor and supervise computer activity. We know that these are some of these protective factors. Do we push out this information? This is just as important as going to that counseling office. Let's notice in our school what we're doing to promote good mental health. Where can students exercise in our schools? Where can we get good food? I know that those are those simple things that the Be Nice leadership groups can push out. Are these simple things, right? A poster could be, notice the great things about yourself today. And if I saw a poster like that, yeah, I might giggle for a moment, but then on the other hand, those are meaningful conversations for myself. Those are those simple things that our student leaderships can be pushing out. Next. And then also making sure that students know the other protective factors in addition. And these are just those good reminders to students. These are protective factors for our mental health. Don't forget where you can get help in our school. Being involved in activities is so important to a school to promote school connectivity. Are we as a school pushing out information to our students about clubs and organizations? That can be part of the Be Nice leadership group. One activity that's on the portal, I think Kat's going to jump in and explain it, is having a fair where everybody knows what clubs and organizations are available. In addition, holding students accountable to be involved in a school organization at that freshman year when they're just entering, so you feel connected to your school. So empower conversations. What mental health protective factors do we have in place for our staff, for our students, for our parents? Again, do we have a staff EAP? Out of everything that has been happening throughout the pandemic, have we been able to actually access resources for ourselves as staff members with all the changes? I'm a huge advocate for mental wellness, and I know a lot of districts encourage mental wellness days. And in fact, I know during the Thanksgiving break, the superintendent at Granville Public Schools actually pushed out, we're going to relax and chill from homework testing that may be going on the week after Thanksgiving. Let's literally take mental wellness over that Thanksgiving break. Pretty bold, and I know probably some people laughed about it, what an excuse, but on the other hand, it's no laughing matter. Let's take it seriously. Being involved in student groups is one of the biggest protective factors. Do we have a system in place to encourage each student to be connected to peers, trusted adults through student groups? Kat.
Okay, hi everybody. Sorry about my dogs before. So again, my name is Kat Lanting, and I'm the program director for Be Nice at the Mental Health Foundation. A lot of you work with Isabella Buck and Candace Sloop, our Be Nice school program coordinators. And they asked me today to take you to the portal to show some of those things that we had emailed out previously this week. So again, I just went to beniceonline.com. You can also find the school portal right from benice.org. And again, if some of you are on that are not current Be Nice schools, this is part of your programming that you have access to. So just a few things that we want to point out for secondary. You can also look at this if you're elementary, and it's talking points with admin, school safety presentation. So the PowerPoint that Christy just went through is right here on school safety presentation, again, under middle and high on the portal. So if you wanted to have this relayed to any other staff members, take a few of the slides. You know, we've been getting a lot of requests of, do you know someone who specifically talks on school safety? Put it under your Be Nice programming somehow, and remember to relate it back to that action plan. And then of course, if you have school speakers, or if you have any additional things happening, gun safety, it's really amazing when your student group or your Be Nice liaisons can present this as where it goes, right? Or your PBIS group, just involving what you already have in place for very upstream prevention. Here's how now we're talking about downstream. So that's right there. We've got talking points with admin, which you'll find scattered throughout Christy's presentation that she just spoke of. But it's a really great document. You know, are we checking these boxes? What we're really tasking you with is whether you are in elementary school or middle high, if you have a set group of students that are doing work with Be Nice, we're going to challenge you to look at this talking points with students piece of paper. And some of those questions are tough. Do we feel safe at school? What can help me feel more safe? Do I feel that I have the ability to, communicate if I'm concerned about another student? But what it also brings out are those empowering things of how can we share what we're already doing with other students? Do we have enough posters up? And your students are ready to spring into action and help you do those things. So one more thing would be to really take that next step and to say, I'm going to open this up here. Let's do it. Let's have a student fair. We found, and not us, but the American Foundation for Suicide Prevention, this came out in 2018, that the number one protective factor for a young person not having suicidal thoughts, and this was specific, like what are the students that are not reporting suicidal thoughts and behaviors, what's their number one protective factor? And they found a relationship between having one adult I can tell anything to. And typically that came from being involved in a group where I have that trusted adult. Sometimes that's a coach, right? Not every student is involved in athletics. And oftentimes we see there's a lot of focus on athletics. In our video, we have one of our characters. Have this really great relationship with the Michigan High School Athletic Association. And we've been asked back, well, we're concentrating so much on athletes. And that's true. It's a great place to learn about your mental health, but also how about everybody else, right? So let's have a Be Nice, and you can just call it a student organization fair. So if you remember being in college when you were on campus, if you went there, you probably had a welcome week where you would walk around campus and it was really expected that you are involved in a group, that you get involved in a group. Do we have that at our school? And I know a lot of your high schools do, elementary, middle. Let's have a fair, right? And really press, we have that letter that goes home to parents, possibly at the beginning of the year, encouraging them to get their students involved. But really asking your student group too, are there student groups that we are lacking? Do we know that all of these things exist? And connecting that with school connectedness, school safety, and being open about it. This is not just extra time, more fun. It is such a protective factor when you have a bunch of other students looking out for one another, working through the action plan. We find that it's a really great thing. So that is one activity that you can find. Again, we attach this to the school safety talking points with students. So I'll just come up here and show you what we've got under notice. What do you wish they offered at school regarding school safety? Are there any barriers to inviting conversations, right? Do students know where they can go to get help? So Christy already asked these questions, but going to that really amazing group of students you have and really giving them the power to say, hey, you are doing this really awesome work anyways. Let's just promote it. Let's make sure everybody knows and is on board. And then again, Christy mentioned those extension lessons. Those are right here in video format. If you would like a text format of these Be Nice extension lessons, reach out to us. A bunch of schools on the call have us come in physically to do Be Nice extension. And again, that's really bad. I was like way back, early 2020 COVID times right there with my hoodie on. But we have that available, and that is in the classroom. And when we see schools that are participating in that, it really is the full gamut of conversations and tough conversations going on one-on-one with students of, do we know these next steps? Are we prepared to have those conversations with adults? And a lot of times they are, right? So again, right here, we'll say, thanks for all the work that you've been doing. This was really a promotion of the fact that you all keep students safe every single day. Thanks for using Be Nice. And Christy put a couple links into the chat. Anything else, Christy? We're ending 5 minutes early.
Yeah, so there's a video out there and I am going to add it in, and it actually was a Sandy Hook PSA, and I'm not going to show it right now. I think it's kind of something that I would encourage everybody to watch on their own, because Let me see if I got it. Was I able to copy paste it? Kat, can you do that? I put it to you. No, I got it now.
It's in the chat. Yeah.
So it was a PSA. It was on TV. It was sent out. We got a hold of it, and it's chilling and gripping. But I'll tell you this, if you watch it with NICE in mind, okay, you see how the plan could work. All right. Again, if you look at it with, this was a promotional video for Be Nice, you'd see NICE right there and what someone could have noticed with the change in behavior. But again, I cannot reiterate to y'all more so is that what happened at Oxford, at Sandy Hook, at any school could have been prevented a long time ago. And that's where we got to be proactive upstream with mental health education, suicide prevention programming at a young age, being able to notice the onset of a person's change in their behavior. And this is where our challenge is, and we cannot thank you enough for being part of Be Nice. And any other school districts that are doing anything else, more power to them too. Because again, saving lives, right, starts early, just like any other illness.